What's going on, everybody? How's everyone doing this evening? For those
Pretty
that are,
good, pretty good.
all right, nice to see you, Nancy. For those that are joining us for the first time on this call, appreciate you guys being here. For those that are coming back again for round two or round three or on repeat, appreciate you guys being here. Super grateful and always look forward to this opportunity to help out and kind of be a guide or provide some direction or answer some questions that might be pertinent to whatever stage of the adult day journey that you're in. I always like to kind of share a few reminders. If you're joining for the first time, we typically will answer everyone's questions one at a time in the order that we receive them in the chat. So if you have a specific question, if you're facing a problem, or if you're kind of just trying to figure out where to start and would like to get some pointers on that, but there's specific questions around that problem that you're facing, put that problem or that question in the chat, and then we'll use that kind of as like a how we store the order in which we'll go through those questions. So I always encourage everyone to get those out of the way now. Take a few moments to throw that question in the chat box there. And the people that throw it in there first typically are the ones that we're gonna be able to talk through and answer your questions. So and then again, for those that are here for the first time, what we usually do on this call is for the first 5 to 7 minutes, we will have a few of you guys introduce yourselves. So before we get into the Q&A, like the next 5 to 7 minutes will really be just introducing yourself, your name, where you're from, what area of the country you're located in, and then what stage of the journey that you're in. And that way, if you have other people that are on this call, they're in your market, you guys can kind of work together or lean on each other a little bit, exchange information and, and in this call. So that being said, whoever wants to, introduce themselves, feel free to unmute yourself, introduce yourself, where you're from, and what stage of the journey you're in.
Yes, hi. My name is Lillian Gibson, and I am from Atlanta, Georgia. And
Atlanta. How you doing, Lillian?
yes, originally from New York, though, New York, Long Island.
All right.
Let me put
All
that
right.
out there. And I've been in the healthcare field for many, many years. And I am now the director of supported employment. I'm doing something a little bit different, working with people with intellectual disabilities. But my daughter, who is completing her program for nurse practitioner, asked me about 2-3 weeks ago that she is interested in opening up an adult daycare center. And I just thought, okay. And she lives in New Jersey. And she was like, Mom, you got years of experience working with seniors and I
Awesome.
just thought I need to talk to some professionals about this. I don't know if, I want to take on such a big task. So I think I went into YouTube and you came up, and I've just been learning about the difference of an adult daycare center compared to a senior center. So I'm already learning the difference between the two, and I just want to know what the journey is and if it's actually worth it. I'm in the human service field, so I do like caring for people, but I just want to make sure it's something I want to do long term, and is it worth it? That's all.
Yep. All right. Well, Lillian, I don't want to cause you to have an accident. So don't type into the chat right this second. But if you get a moment to pull over, feel free to put any specific questions in the chat. I think there will be questions from others too that you might be able to learn from on this call. But if you have specific questions to the stage you're in, throw it in the chat when you get a chance to pull over there. Don't want to be the cause of an accident. So definitely look forward to hearing from you, and I'm glad you're here. We'll go on to maybe about 2 or 3 more people. Just introduce yourself, kind of lightning round, your name, where you're from, and the stage of the journey you're in.
Okay, I'll start. My name is Francis Clement. I'm in Nanuet, New York, Rockland County, and with a few friends, we are trying to open a social adult daycare center, and I'll cut to the chase. Our basic question is, once we partner with you, let's say it takes 3 months time. How can
So Francis, we're going to get into Q&A here shortly. So put your question in the chat, my man.
Okay.
And we'll dive into questions here in a second. So we
Okay.
got Francis from New York, Social Adult Day. Who else is wants to introduce themselves? And
I am.
hi, Nancy. How we doing?
Hi, Kris. I'm fine. This is my I would say many time to be here. And I am in the process for quite a long time, almost a year right now. And I I think I'm
Wait,
stuck a little bit at some point because I need to sorry.
No, is it maybe tell everyone where you're from and
Oh, I'm from Massachusetts,
Yep.
North Central Massachusetts. So, and then I am in the process to have this adult daycare, but it's been quite a while, and I am a little stuck. So I'm gonna listen to everyone to see what they have to say, and then I have a couple of questions also that I'm gonna put in the chat.
Perfect. Yeah, put them in the chat, and we'll get to it here shortly. Thank you for being here, Nancy. All right, we'll do two more folks real quick.
Yes, hi. My name is Sharon Matthew. I'm a social worker settled in upstate New York. I have a couple of questions about starting up a social daycare in New York.
All right. Looks like we got a few New Yorkers in the house today. You know, Lillian may not live in New York anymore, but she's from there. So
Yes.
we got New York representing. It's always funny because when we do these intros, sometimes we'll get people from a lot of people that are in that Georgia, Atlanta area. Sometimes we'll get Florida. It's always interesting because every call it seems like there's a hot area that some of the folks introducing themselves are from. So glad you're here, and definitely throw your questions in the chat, and we'll get to those shortly. Right now, unless I'm looking at this chat wrong, I only see one question. I don't know if you guys are putting them in the main chat, but I just see Alexis's question. So if you haven't already, make sure to add it. I know Francis had a question. Put your question in there, and I think Sharon, go ahead and add yours to the chat as well.
Okay.
And we'll dive into those shortly, and then we'll do one more intro. Name, where you're from, and what stage of the journey you're in.
Good evening.
How are we doing, Yolanda?
Good evening. My name is Yolanda Elliott, and I am from Nevis. I watch your YouTube videos all the time. Yes, hello. I watch your YouTube videos all the time, so I feel really excited to be a part of this webinar. I am hoping to open a social adult daycare center in Nevis, and I am looking for some tips.
Absolutely. And you said Nevis, Texas? Yolanda, you say Nevis, Texas? I just want to make sure I got that right. I'm not sure if she's still there or not. Anyways, well, how about this, guys? We're gonna jump into it now. So we got about 26 people on the call. We got a nice little call for everyone here today. All your questions. There are no wrong questions. So this is this call is great for anyone that's thinking about getting started, all the way to those that maybe had just opened their doors or they're about to, and you're kind of maybe facing some different struggles and or like what are some best practices or next steps, or you just open your doors and need a little guidance there. Like we can answer that wide variety of those questions that you might have. So there are no wrong questions. There's no wrong stage of the journey that you might be in. But typically for anyone that hasn't been on this call before, this is usually like a great place for people who are looking to get started. This is a great call for them. So that being said, Alexis, since you were the first one to sneak your question in there in the chat, we'll go to you. Feel free to share your question. You can unmute your mic, share your question with all of us, and we'll talk through it together.
Sure, I actually had two questions. I'll start with the first one, and then if there's time, I can ask the second one. So I'm trying to decide if it's worth it to work with somebody to help me just with the licensing process. And I just wanted to hear like the pros and cons. What are the factors I should consider?
Yeah, as far as getting help with licensing, I think the licensing process can certainly be like a little daunting. So when you're kind of going through that process, every state's a little bit different. Whatever the that particular state like that you're in, the licensing is going to be very different. It's some states have licensing requirements, other states don't. Some are clear, some are a little unclear. There's different licensing requirements sometimes around social versus medical. And then sometimes there may
And
not
I'm
be a
in
license
Georgia.
for.
I don't know if that I'm in Georgia. I don't know if that matters. But I know
Gotcha.
they
Yeah.
I've read their licensing requirements. So I know they have very specific requirements.
Yep. So I mean, when you think about hiring someone to get help with that, I always find that like if you can find a consultant or if you can work with someone in that state that's really familiar with those regs, like if someone came to us and needed help with licensing when it comes to Florida, like we know that process, really, really well. Like we've been through that plenty of times. There's a lot of little like things that we can do to like help shave some of that time and kind of make it a little bit easier, navigating it a little bit better, and kind of having clearer expectations for the time frame. So, if you are in Georgia, I think like a good place to always start is with your associations. As far as if you don't have any contacts in the adult day industry and you're trying to figure out who should I talk to that's in adult day, that the association itself is always a great place to start. You're networking with other adult day owners that might be willing to help out or provide some advice on the licensing side. If you already read the regs, you've already done a lot of the legwork, and so really it might be just getting some pointers from other adult day owners that can kind of guide you through the process. So if you're someone that you feel like you can figure out a lot of these things for yourselves, instead of having to hire a consultant or someone that can help with licensing, it may not be a bad idea just to reach out to another adult day owner in the area. So that being said, I think you had another question in there too, Alexis, right?
Yes. Okay. I'll go ahead and ask the next question. The next question was about staffing, and I wanted to just hear any suggestions or experience you might have when you need temporary staff. So when you have staff that's called out sick, have you had experiences working with a staffing company just to have, extra staff to make sure you're meeting the regs around staff to participant ratio. So just wanted to get advice around temporary staff.
Yeah, I think one of the things that we do on the staffing side, temp staff or I think the idea of calling a staffing company always sounds good. It always sounds like a great way to have a backup. But what I've learned in my experience is that a lot of times if you have that call out, you're trying to fill a last minute shift, and so now you're trying to rely on a staffing agency to come through in a short period of time to fill that shift, which is going to be a big lift for them to do anyways. And then when that person comes there, they may not be trained on like how you operate or run your center. So a lot of times, what we do is we might have a core group of full-time team members on our team, but we always have like about 3 to 4 PRN or part-time, I should say, folks. Like, so I know like in both our Sarasota and our Port Charlotte location, we have at least 2 or 3 team members that might be part-time. They work 2 to 3 days a week. And by having a few part-time employees there, these could be folks that maybe they have another job, maybe they're going to school, they just need a part-time job, or maybe they're like semi-retired and this is an outlet, a way for them to kind of give back and keep them, busy, occupied, and feel like they have a sense of purpose. And having those part-time team members is very helpful when you have someone that takes vacation or someone calls out or something comes up, because you have more flexibility in their schedule.
Would you, just a follow up, would you do that same approach when you're first starting out? Because I'm thinking like when I first start off, I may only have a few participants. I would have very limited staff in the first place. So would you approach any different when you're first starting out?
Yeah, I mean, when you're first starting out, the experience that you provide to your members is extremely important, especially if you're going the private pay route. If you're going a Medicaid route, it's a little bit different, but if you're going a private pay route where, families are coming out of their own pocket to pay for these services and stuff like that, it's important that the team you have in place, like they know how to run the day. They're trained on, the things that are important to you, and they know how to, they get to know your members and the intricacies of, where they might be at in their different stages as far as dementia, Parkinson's, Alzheimer's. So having your own team that you've been able to train, that you've been able to coach and mentor and kind of influence on how you want your day run is super important. So even when you're first starting out, there's nothing wrong with having a few part-time employees to help you out that are filling the gaps or filling the needs, on those days that you're busy. You might have a handful of part-time folks that are maybe coming in and working a 4 to 6 hour shift a couple of days a week, and that's kind of how you're getting your, started until you get to a place where, hey, we have enough people here now where I can hire at least one more full-time person, and then I'll be able to retain those part-time staff from when we first open. And then, that's going to help build in some flexibility, but also create and help you maintain that consistency with your team and your operations, because they'll know how to run the center, because you'll have trained them. They'll have been there and been part of that journey with you.
I think that was really helpful. Appreciate it.
All right, Alexis, thank you. Appreciate it. And definitely reach out to your association, and if you have more specific licensing questions that are specific to Georgia, for sure. And I think we had Lonnie up next.
Good morning. Or good
Hello.
evening.
Yeah, how are you?
I'm good. So I'm actually in another meeting. I kind of snuck away. But,
All right, well, look at that. That means our meeting was more important.
well, okay, so I own Guam. I'm from the island of Guam. And I own the first and only private adult daycare. We have 3 other adult daycares, but they're government run.
Oh,
So
wow. Well, congratulations to you, Lonnie. You're going to teach me a thing or two.
Well, I think what I'm looking more at is, are there any, we're a social adult daycare. So all the insurance companies, they say they don't cover that, there's no real help. So it's pretty much a self-pay type of
right
center. Are there any other grant subsidies or anything else that can assist that you know of in just paying for adult daycare? And these are questions coming from our clients or participants.
Yeah, what's hard, what's interesting to me and intriguing is, one, just I would love to visit an adult day center, like say in Guam, and kind of even learn about that market and who you're serving and what they're walking through and what price points are and stuff like that. When I think about grants and things like that, or other subsidies, like in where we're located, I always think of the nonprofit organizations, that we have in our area, it's called the Community Foundation. A lot of times people who are maybe independently wealthy, like in certain cities, they will have established these these local community foundations where these more wealthy people will come to, and they'll kind of pledge some of their inheritance to these community foundations. And the community foundations are sources that kind of help them identify, if someone's coming in there and they want to pledge 100,000 or $500,000 or $1 million, these community foundations will kind of help them identify what causes are important to you, and what are some of the things that when you think about your legacy that you want to continue to support, and they'll kind of help them develop a plan for how to go about spending their donations, and then the local businesses in that community can then go and apply sometimes for those local grants or for those funds. And then there's also state ones, for this, here in the state of Florida and a lot of other states in the US. But when I think about your area, and I don't know if you have a community foundation, that exists. I don't know if
No,
like,
we don't.
I
And
don't know if
the
there's
Guam is a territory.
yeah,
Guam is a territory, but we don't have any. We're a population of about 160,000 people.
right.
And we don't have any real, you know, community funds like that available.
Do you, Lonnie, do you guys have a lot of, does money come through like a lot of any like churches and stuff? Like are churches like a place of fundraising at all in Guam or no?
We do have churches, but we don't fundraise with the church.
Got it. Well, I just didn't know
So
if like maybe they
we
had
also
partner
run
churches
childcare centers.
yeah,
I run preschool centers in Guam. That was my original forte, and I decided, we want to take care of our elderly as well.
yeah.
So with childcare, there's all these grants, federal funds for childcare, but there's nothing for senior care. So I'm wondering if it's only because this is a new thing to Guam, period, and maybe we just haven't, figured out if there's any funding available. I mean, when I was first opening up, it's so new that the agencies that were inspecting had to kind of use my model as the first. They had to take pictures, and they're creating the regulations as they were
Yeah.
doing the inspection.
And,
So
and what's interesting, Lonnie, is that that's common too, even in a lot of states. In the grand scheme of long-term care or senior care, there's 35,000 home care agencies that exist in the U.S. and there's 28,000 assisted living facilities, 15,000 nursing homes, and there's about 4,000 adult day centers. So in comparison, adult day is a very, very small. It's like the smallest percentage of the market compared to these other long-term care solutions. So for a lot of states in the US, the states themselves don't even have a lot of regulation, or they don't even have appropriate regulation sometimes for adult day centers because of the fact that they just don't exist to the same level or degree as, like, say, in-home care or assisted living or these skilled nursing facilities. So it is kind of uncharted territory as far as, you're dealing with, the lack of awareness of, people not knowing what adult day is. You're dealing with a lack of funding from either federal or state, resources, just because, they don't know what this is. And a lot of times insurances don't pay for it because they may not recognize it as a healthcare benefit. And so there's a lot of complexity sometimes when it comes to the funding side of it. In the US itself, primarily, Medicaid is the largest funding source of adult day centers. But outside of that, there are no
the
federal
Medicaid doesn't even
programs.
cover it.
Not in Guam.
No. So that's why
Yeah.
I'm wondering is,
Yeah, Lonnie, I feel like I'm gonna have to do some more research on
yeah,
Guam
okay.
itself and in that market. Just I'm intrigued. I would love to visit and just even learn about like how that operates and how that looks in that area, because I think I've always been intrigued by because there's adult day all over the world. My buddy that owns Story Care, for those that maybe are getting into this and are looking for a software company to help run their electronic health records and stuff like that. StoryCare is a great resource. But Cameron, who founded it, I mean, they're in like, I think, 18 different countries, all over the world. And it's just so interesting to me, like, how all these adult day centers, I'm sure there's a lot of similarities, but there's also a lot of probably differences depending on what area of the country they're in. So Lonnie, I wish I feel like unqualified to answer your question for the area that you're in, but I'm very intrigued to learn more, and I will if I come across any research, I'll certainly send it your way. But you've piqued my interest about
I'll email you an invitation to Guam.
yeah, I
Catch you
love
guys.
it. I love it. And nice to meet you. Thank you, Lonnie. We got Misha on next from Texas. Misha, you there? Don't know if Misha's still on. If not, we can roll on to someone else. Let's see here. Looks like Francis, you there?
Yeah, hi. So I was wondering, since we have adjacent states of Connecticut and New Jersey,
Yep.
and we are based out of New York, in your experience with adjacent states, are the rules all completely different state to state, or you have a radius of states where the rules would be similar?
Yeah, so every state is going to be different when it comes to licensing and when it comes to Medicaid reimbursement. So like those are those are going to be the two biggest differences state to state. So if one of the things, for those that have maybe seen some of our YouTube channel videos, one of the things I often am sharing with people is, when you think about starting your own adult day center, it's very important for you to understand the type of adult day center that you want to start. So for instance, when you think about an adult day center, I think there's 4 categories that you kind of have to, choose from to kind of figure out like what your identity is. Like, what type of adult day center do you want to run? And if you can identify the type of adult day center you want to be, it allows you to kind of, better navigate, create more appropriate marketing material, and kind of, get a little bit more clear on like the size and the way you want to maybe do a build out and how you want to handle billing and things like that. So that being said, the number one thing is like, do you want to be senior focused or young adult focused? The other thing is, as far as a payer source, is your payer source going to be primarily private pay, or is it going to be Medicaid or state funded programs? The third one is, choosing between that social model, which I know, Francis, you said that's what you're going with. So social versus medical. And then the fourth one being, do you want to be a for-profit organization or a nonprofit? And so to give you an example, when I think about our locations, we are we're a for-profit organization. We cater and kind of have a focus on senior care. So we're handling and more specifically caring for those that have dementia, Alzheimer's, Parkinson's. Our primary payer source is private pay. So individuals paying out of their own pockets, long-term care insurance. And then lastly is we do have a medical focus. So those are kind of like, that's like our identity. So I think when you think about yours, Francis, have you identified the type of adult day center you want to be?
No, that's what we were in a quandary. Should we begin with the medical model first and then, I mean, should we begin with social first and then add on medical at a later stage, or begin with medical itself first? And the question, like you rightly mentioned, it'll be good for a person to be in either or situation, that is, take Medicaid or private pay versus having a.
Yeah. So when it comes to like to answer your question on the medical versus social, a lot of times the decision around that will depend on the state regulations for like how the state licensing regs, how are they different between the social versus the medical model? So in the state of Florida, there isn't a separate license for social versus medical. The two different license types that we have here in the state of Florida is we have your standard license, and then we have a specialized Alzheimer's and dementia-related disorders license. So it's like a specialized Alzheimer's services license. And so both the kind of standard and that specialized Alzheimer's license in the state of Florida, both of them kind of still allow you to provide medical services, and you kind of are, acting in a lot of ways, with like medication management. You might have, physical or occupational therapy that typically is, sourced or done by a third party. So it's not like you're the one with, physical and occupational therapists on staff, but having those benefits, are helping you, kind of cater to, more of a medical model. So a lot of times, the state itself, you might have to look into the regulations between social and medical and see like how much greater is the medical licensing requirements, and is it worth for me to go that route, and then that way I can be basically both social and medical, or is it easier for me, the path of least resistance with less regulation, less red tape, and just getting started sooner, is to go the social model. So it's always like going to be important for you to like assess like what are the state licensing requirements around medical versus social? Is it a blurred line? Is it very definitive? Some states don't even require a license for social models, but they may for the medical model. Some states require a license for both, and then you got to identify the type of adult day center you want to be. So depending on that state and those licensing requirements, you know, that may help you make a better decision around if you want to go social or medical. But at the end of the day, you know, when you're caring for seniors who have dementia, Alzheimer's, Parkinson's, you know, there's typically going to be a little bit of an underlying medical need. You know, it could be medication management, it could be personal care, helping someone to and from the restroom. You know, and so there's elements that kind of tie into that senior care focused, where you have folks that are coming in there that have dementia, that having the ability to serve them and provide them with their personal care needs and assistance with activities of daily living, is going to be beneficial to you serving your community well.
Good. Thanks for that insight. My last question is, have you consulted for a similar situation in the state of New York, medical versus social?
So not specifically around licensing. Usually when it comes to the licensing side of things and it's state specific, I have like there's a lady, I don't know if you're familiar, Francis, with the lady, her name is Joan Marie. She's kind of, I think, in the New Jersey area. I know, but she does help people all throughout the country, and she's more Medicaid focused medical model adult day center, and she's familiar with New Jersey really well, and kind of definitely has a lot more connections in the Northeast. But her name is Joan Marie, and I believe her consulting agency is like called Future Focus Adult Day Consultants.
Okay, awesome. Thank you.
All right, Francis. Nice talking to you. Nancy, I think you're up next, sir, Nancy.
Yes, I am here. I'm so glad you gave this information about this adult day consultant. If you can send her number, her contact information, that would be.
Yeah, I'll try to put her website out there. So, but go ahead and share your question while I look that up.
So my question is, I am a little stuck in the process, and while I sent all of my information to DPH, and they requested some information. I sent back to them, but now I am stuck with the floor plan that they requested from me. So I understand that the DPH requirement is to have like one bathroom for every 12 adults that are going to be there. But since I only have like 12 clients to start, that was also one of my questions. Do we have like a minimum amount of patient that we need to have, number of patients that we need to have to start an adult daycare? That was the first question. Second question is, since I have 12 clients to start, so I'm wondering,
And when you say
where
are you
can
saying do you already have 12 clients that would be willing to
No,
start with you, or
I
your
haven't
plan
started.
is
This is a plan.
okay.
This is the plan to start with 12 because of the place that I have. So the city told me that I cannot have more than 10 to 12
Got it.
to start. So I'm wondering, where can I find like a professional who can create a compliant floor plan for this facility for me? The third question is for the SBA loan. So while completing the SBA loan worksheet, so I wonder, should I plan to hire, because I need to put that in my worksheet, should I plan to hire both a payroll service and an accountant, or would one of these be sufficient for my needs?
Yeah. So, in my experience, so to answer your first question on the clients side, so you're limited to 12 clients because of the bathroom requirements?
No, because of the place, the square feet, the
Okay.
square footage, yeah.
Got it. And you need help with like evaluating the floor plan, like creating a new floor
The
plan.
floor plan, yeah.
Okay, like so this would involve like recreating the floor plan and then reconstructing it to match that updated floor plan.
Exactly, because I'm gonna have a renovation of that place, and I need the renovation to meet the requirement, the state requirement, because they required like a staff bathroom, two bathroom for the clients, and also they asked me to have a break room for
Yeah.
the staff and things like that. Yeah.
Yeah, so it sounds like it's not going to be a massive remodel, you know. So for instance, like say you're doing a big remodel on a 6,000 square foot space, and you're having to, demo the entire thing and then rebuild it from scratch. You know, in 6 to 8,000 square feet, you're probably going to need architectural drawings, hire an architect, hire a GC, have them go through the permitting process, create the floor plan, make sure all these elements when it comes to the Department of Health, fire safety, all that stuff is in check. On a size like yours, Nancy, the best thing to do is probably just find a good general contractor in your area that's familiar with your state or your county's local regulations. And you have a sense for what you need, and so then you being able to um, express to that GC, like, what requirements you need to meet the state regulations around this adult day center, and then them helping you develop the floor plan and figuring out which walls, we can take out, which walls we can keep. Do we need to add a bathroom? And then the GC themselves, they probably won't need to hire an architect to, do that. They would probably be able to, do some of those floor planning, some of that floor planning in-house, which would save you as opposed to having to hire an architect separately. And then, they could work with the, the offices there, the county to, get the permits, make sure everything's done correctly and that you're, meeting whatever state requirements or county requirements are there.
Oh, okay. Okay, thank you.
So, definitely start with the GC. When it comes to the payroll side, to answer your question on that, really, you don't necessarily need an accountant to handle your payroll. The best thing for you to do, like when you think about, bringing on employees, and dealing with a payroll service, definitely work with a payroll company. In our experience, we've done, so it depends on the state, because every state's a little bit different as to whether or not they allow these types of companies, but they're called employee leasing organizations. It's I think it's called an EPO or something like that, and like employee professional organization. And some states allow them, some states don't. Depends on your state. But essentially, what it is like it's like a payroll service like Paychex, but instead of just processing your payroll for you, what's nice about it is like our employees, and all work for this employee leasing organization. So they go into a pool. Our employees are registered underneath our organization within this pool, this larger pool of employees that on paper all receive a paycheck from what our company is called Worksite Employee Leasing. But what it does is employee leasing organizations allow you sometimes to get better rates on workers' comp, and it can reduce, and like say you had a claim for like a workers' comp claim or something like that. Sometimes if you had just a regular paychecks and then you had to purchase your workers' comp policy like as a separate thing that was just for your 4 employees, um, and if someone ever had an issue, you could potentially get denied future coverage for insurance. Whereas when you're with like an employee leasing organization, you know, you're sharing the risk amongst all these other companies that have their employees set up with this company. So if something happens to you, it doesn't necessarily ding you, or cause you to lose insurance or cause the insurance rates to increase exponentially. So you kind of insulates you from some of those effects. Plus, any of the risks associated with payroll taxes are on that employee leasing company. So if there's errors or things like that, they're not going to come back to you for it. If there's issues with filing unemployment claims and things like that, they won't be your responsibility. The employee leasing company will handle all that like on your behalf. Like essentially, like if we have to let someone go and they go and file unemployment, like as long as we provided to the employee leasing company the reasons for what, the steps we took before we let them go, and then the reason why we ended up letting them go, like the employee leasing company handles all the paperwork and everything on the backside of it. So as far as the accountant's concerned, really, you're going to need that person when it comes to, you might have them if they have or offer bookkeeping services, or you might just have them help you with your taxes when you go to file at the end of the year. And you're doing your corporate returns, so, but you may not necessarily need them for the payroll side.
Oh, okay. So this employer leasing organization, are they like replacing as well the insurance company?
So typically, like the employee leasing company, you'll be able to get your workers' comp insurance. You'll be able to get health insurance, or kind of a la carte, kind of like your Aflac type insurances through that organization, and be able to offer that to your employees. When it comes to the insurance of the adult day center, you would reach out to a separate insurance provider, maybe an insurance company that maybe specializes in healthcare businesses.
Oh, okay. So do you have an
Or-
example of this employer leasing organization you just talked about?
Yeah, so we use worksite employee leasing. But that's out of you could I think I think ADP, so ADP, which is a larger national organization, I believe they have just payroll services, and they also now have an employee leasing division. So you could maybe start there with like ADP or Paychex and kind of explore. When we signed up with the employee leasing company at the time, Paychex didn't have that employee leasing service, and I don't think ADP did either, but this was like 14 years ago. But I know that some of those companies, those larger organizations, have started to offer this, kind of different types of services underneath it. So they might have just regular payroll services, or they might also have a employee leasing division that falls underneath that organization. So you could certainly reach out. I believe ADP has it. You can certainly reach out to some of the larger organizations just to, find out whether or not they have employee leasing options, and if that state, like Massachusetts, allows for these employee leasing companies to exist. Because it's going to be state specific right now as to whether or not the state recognizes employee leasing as a as an actual payroll model.
Are you familiar to Vision Payroll?
I'm not. No.
No, okay.
Yeah, but
I was
but
wondering if it's one of them. Okay.
I'd have to look into that. But ADP is big enough that they'll be able to tell you more about your own state's specific payroll needs too. So definitely go to
Because we are
them for sure.
very, yeah, because we are very small.
Yeah.
It might be a very small one. So I wonder if we can still use like Paychex or ADP.
Yeah, you can. Yeah, most of them just charge a percentage of payroll, so it's usually pretty affordable. So like I know for us, like our administrative cost that we pay for this service is just a percentage of our payroll. So when you're first starting out and you got a really small payroll, like it's not a massive expense. So but then as you grow, then it becomes a bigger expense, and so usually it's this service is not too expensive, even with the bigger boys. So.
Okay. I
And
do
then
have another question.
well,
My next question
I
will
got,
be,
I got to go on to the next one, Nancy. I've been spending a little too much time with you, girl. But
okay.
if I have a little more time after this, then we can
What,
circle back. Okay.
listen, what's the name of the book that you said that is on the Amazon?
Oh yeah, The Great Care Crisis. If you go to the top of the conversation, the very first post in there, I have a link to it. So it's called The Great Care Crisis.
Okay. Thank
All
you.
right. Thanks, Nancy.
Thank you too.
All right, Sharon, you there? Sharon
Yes, hi.
Matthew, how
Yes,
are you?
hi.
Good, good. Let me read my question. So in upstate New York, we are planning to start a social daycare. So what is the minimum capital seed you think to start a day social daycare? We are aiming like a 30 number of elderly clients, both Medicaid and private pay for profit. And we are already have a building. Except the building rent, how much money do you think the capital that we need to have?
So do you already have a building, like a lease, or
Yes,
do you own a building?
for lease, yeah.
Okay. And is that building like, so like, is the lease already in place? Like you already have the lease in place?
No.
Okay. But you have one in mind, you're saying?
Yes.
And how much like is that lease per month for the
It's
space you're thinking
almost
of?
5,000 per month.
5,000 a month. Okay.
Yeah.
So, and then how much money in construction do you need to, is there any remodeling or construction that needs to be done?
No, it's already, remodeled and everything. It was another
Gotcha.
medical, a building before. So it's almost
Okay.
already wheelchair accessible, bathrooms, parking lots and everything there.
Gotcha. So,
Yep.
so construction cost is not a major concern. You're going to have just primarily carrying costs of the leased space. So like, really we're down to marketing, the licensing process, the carrying costs of the lease space, any payroll expenses that you incur to get open. So I'm just trying to do some rough math in my head. Are you or someone? I don't know if you have do you have a partner, or is it just
Yeah, we are
you?
planning to do with the partner, like 3 other partners.
Okay, and are they going to be active, like physically working in the business with you, or
And
are they?
some of them are planning active, some of them is like putting the capital, but passive, that's
Yeah.
what we didn't, yeah, we that's what in the planning process.
So when you're first starting an adult day center, you're like, your first kind of payroll expense typically, if you're able to financially do this, and is going to be, you're going to want to have like, an administrative manager type person, and then you're going to want to have your marketing, sales director type person. Do you have those two people, or would you have to hire for those two
No,
people?
we have to hire.
Okay. So, because those are going to be kind of like two of the like larger payroll
Right.
expenses that you're going to incur in the beginning. The fact that you don't have to worry about the construction side of it, I would say that you're probably going to be anywhere between, if like 200 to maybe 400, 500,000, to get off the ground and then to get to profitability.
And we are
that's
able,
if you that's if you hire for all the roles.
right.
Now,
Right.
if you and some of your partners like, hey, we're going to dive into that and pitch in, and we're going to bootstrap this together, then you're probably closer to like 150 to like maybe 300.
Okay. And private pay, can we include both private pay clients and Medicaid? And can we bill more from the private pay clients, or does it have to be the same Medicaid reimbursement amount?
No, so private pay like is free reign. You can do whatever you want. Whatever that market, that area you're in, whatever they're willing to pay. There's no controls or regulations around that. When it comes to Medicaid, there could be regulations or controls around whether or not you could charge people for the difference. So sometimes Medicaid will frown upon that. Like it's, whatever you agree to, like you can't go charge the other, like if your private pay rates are $100, Medicaid pays 50, you can't go collect the other 50, difference between private pay and Medicaid on your Medicaid clients.
But private pay clients, if they're willing to pay, it's okay to get more money from them than the Medicaid reimbursement, right?
For sure. Yeah, 100%. Yeah, I mean, our like we, in our Port Charlotte location that we have, we're about 5% private pay, about 15% is VA, 10 to 15%, and then the rest is Medicaid. And so for our private pay folks, on average, they're spending anywhere between $100 to $140 per day to be in our center. Our Medicaid reimbursement is terrible in Florida. New York, New Jersey, some of those states are a lot better. But I think we are reimbursed anywhere between $50 to $75 per day for some of our Medicaid folks.
Okay.
You know, so in some cases, you know, it's like half of what our private pay folks are paying.
Right.
Yeah.
Yeah.
But I think, you know, when you think about that working capital, that seed money, did that seem more than you were thinking? Did it seem in alignment? Where, you know,
Yeah.
um,
I have one more question.
okay.
So, what is the reimbursement rate? Can one client can be both adult and social daycare if they both have the need for social and medical? If we start both?
Yeah. So you talking about on Medicaid reimbursement?
Mm-hmm.
Yeah. So I would have to look into the New York regs about that.
Okay.
Because I don't know. Are you familiar with the billing codes?
No.
No? Okay. So sometimes there might be a base rate with like an additional code that kind of like is like a separate tier, or there might be a separate code, you know, that like, you know, that you would bill for people that are approved, and your authorizations, you know, from the state are going to be like what ultimately kind of restrict you or allow you to bill for the different codes. So if the authorization, it'll either be like they send you an authorization and it's the base you know, rate, like that code plus this differential, you know, for the additional services, or if it's a tiered structure, or there might just be a separate code that's just for the medical services, you know. So like, you know, understanding your state specific Medicaid needs is going to be kind of like your next step, doing a little more digging on that, you know.
Okay.
All right.
All right. Thank you so much.
All right, Sharon. Well, thanks. And then, hey, if you just going back to your seed capital question, if you go to our YouTube channel, we made, I think, 3 different videos with different size adult day centers. So I don't know if it was like 2 to 4,000, 4 to 6, 6 plus. And there's 3 different videos, and I believe it's in the startup stage or the financial section on our playlist on YouTube. And you could, you know, go there and it kind of shows you how that dollar amount is broken down, like how much of it is for furniture, fixtures, and equipment, how much is it is for payroll, for marketing, so you can kind of like start, you know, breaking down this, you know, seed capital cost that you're thinking about. Okay.
Okay. Thank you so much. Sure.
All right, I think we got Mira.
Hi.
Hi, Mira. How are you?
I'm fine. I'm from New York. So I have a question that to meet the operational standard of a standard adult daycare, is there any core optional services that we need to require, or do you recommend anything?
Mira, where are you located?
In New York.
Oh, New York. Man, everyone's from New York on this call. Dang. This is like, hold on. I should have called my New York friends to come join me on this one. Are there, so, you know, like most states are going to like I don't know if you're thinking of like, is there a standard operational like standards, you know, that you need to have when the state walks
Yes.
in and they're doing a survey, and you got to have like your you know, checklist items so that like you
Yes.
can meet the state's you know, requirements. Yeah, so most states are going to have that, you know. You know, most states will have like you know, what they require to be a part of your operating standards, you know, might be different. Sometimes the state within the licensing requirements may list, you know, the basic points that they want you to have in these operational standards. There are people out there that, you know, have these kind of standards already, you know, or these like booklets, you know, policies and procedures, operational standards, or a manual that are state specific. You know, so you know, because it's New York, I'm sure there's probably booklets out there that you can buy that are like boilerplate. You know, you pay a flat fee for them, and they'll send them to you. Bruce, with, I don't know if I've ever spoken to Bruce, but Bruce with direct care training, he might be one that has kind of a boilerplate one that you could purchase, you know, from him. I think it's called directcaretraining.net, directcaretraining.net. And Bruce McCollum, and you know, he's built out a lot of like operational procedures, manuals, things like that, and I bet he has one for New York.
Oh, okay. I heard you talking about the staffing and the clients regarding those things. Is there any specific ratio that there should be a staff, like for this much clients, there should be certain staff, or is there any ratio for that or no?
Yeah, so every going back to the licensing requirements, this is where you kind of have to dive or dig a little deeper into your regulations. So every state might be different as to what that ratio is, or even if they share it or not, or how it's built out. Like for instance, in the state of Florida, for these two different types of licenses under the adult day models, we have one, that's 1 to 6 is the ratio that they require, and the other one is 1 to 5.
You mean 1 to 6 is for the social and the medical, or is it any difference?
So in the state of Florida, we have two different license types. It's a standard licensed adult day center, and then we have a specialized Alzheimer's services license. So it's not medical and social. It's kind of like this. That's why what's tough sometimes is every state's so different. There are states that are going to have a very specific licensure. It's a different license where social and medical have their own regulations. In Florida, the differences between the standard license and the specialized Alzheimer's care license is a little, there's some blurred lines because both of them kind of incorporate some medical services. The specialized Alzheimer's one really has a lot more regulation that's kind of catering to just knowledge, ongoing CEUs, a certain percentage of your your weekly hours, your caregiver hours or your employee hours have to like a nurse has to be on staff at least 75% of the time that you're open. And so like where in a standard license, we can still do medication management, but it doesn't require you to have a nurse on staff 75% of the time that you're open. So, that's the kind of blurred lines between like say Florida versus say like New York or other states where they may have a license that's specifically built for social and then a separate one for medical.
Oh, okay.
Yeah. So like if, we're like so our standard is 1 to 6, our specialized Alzheimer's care one is 1 to 5.
Oh, okay. Do you recommend any additional like that we can bring up some additional revenue for the social daycare? Any additional services that we can bill Medicaid? Anything special besides the special code which you told me, which you said mentioned? I don't know which code we use in New York. We have to look for that. But is there any additional services you recommend from your own part of the business you do?
Yeah, I mean the hard part is we're primarily private pay, right? So 90% of our revenue is private pay, VA, long-term care insurance. So Medicaid is not as big of a focus of ours.
So you said about the VA. So you mean like you bill the VA patients separately, or is it they come under the Medicaid?
Yeah, so veterans, the veteran program or the Department of Veteran Affairs, has a reimbursement or benefits for veterans where they can receive adult day services, and you can bill the VA directly for that. And the VA reimburses, it's a very reasonable. I think it's like 125 or 130 something a day. So it's a healthy rate. It's a healthy reimbursable rate. Through the VA, you could bill for transportation and you can bill for showers. And in most states, that's the same for Medicaid. So, and it's common that I have seen that a lot of people, if their primary payer source is Medicaid, the way that they earn additional income on their own members and clients, and really kind of in a lot of ways, it's the only way they can get those members to and from their adult day center is by offering transportation. So it's probably the single greatest way to increase your billable revenue is by adding transportation, because a lot of your Medicaid folks, they may not have their own means of transportation to and from you. They may not have family there to like to drop them off or pick them up, and so transportation will become a key component of it, and it's another way for you to bill for additional revenue.
Okay.
All right.
Okay.
Well, thank you, Mira.
Thank you.
I have a quick question. I'm sorry, I'm on my phone. I'm not on my laptop, but I promise you the next time I come on, I'll be on my laptop.
All right, we're gonna get Lillian's question, and then I'll do one more question. So go ahead, Lillian.
Thank you. I appreciate you. This is just so wonderful. You don't know what a blessing that you are sharing your knowledge like this. My question is, what are your thoughts on serving food during the day? Some of the paperwork that I'm reading, it's asking, are you going to have a kitchen? Are you going to serve food? Are you going to serve breakfast, lunch, and dinner? What are your thoughts on that? Building a kitchen in there or Wiggles on Meals. I just want to get your take on
Sure.
that.
Yeah.
Or can they bring their own lunch? I don't know.
Absolutely. So, I got, really great insight on that. We started our first adult day center, and when we opened it, we catered. So we there was a deli across the street from us. They already provided free transportation, or free delivery. They kind of catered to businesses in the area. So like their whole shtick was like they had a daily special, and they would offer free delivery, and they did this to businesses all throughout our community. And so we were like, man, this is a great partnership because they already have a daily special. So we essentially just partnered up with them to do catering, and we just uh, basically whatever their daily special was for that day, we kind of worked with them to you know um, take advantage of the fact that like we could get this discounted catering because they were already producing all these meals for all these businesses in the area, already doing free delivery. That we worked out a deal with them that we kind of paid a discounted rate for their daily special per person that or per meal that they would deliver. And that's how we got started. And in the beginning, it was great because the food bill, we're serving 5 people a day the first couple of days, then we're serving 7, and then we're serving 10. All of a sudden, you're serving 30, 35 plus your staff, and the food bill, goes from a small little cost to like now it's, you're spending 6, 7 a month on the local deli. And it was in that moment, about 2 years into our adult day center, that we went back and, because at this point in time, when you're serving 35 people and you're catering, when all that food comes in, there's still someone that has to like unpackage it and then re-prepare it for your members, because some people have special diets. Some people, you may not, they have preferences. So it's coming in, when it's catered, like kind of in a, in big trays, and so it has to be broken down. So long story short, if we're bringing in food at 10:30 and breaking it all down, preparing it, and putting it in warmers and all that stuff, you already have someone in the kitchen that's working behind the scenes, trying to plate all this stuff and organize all this food and make all this stuff happen. So then we started having this additional expense every day of, you got someone already working in the kitchen, plus we're paying for catering. And at 35 people a day, it becomes a big expense. And so we eliminated catering once we got gotten up to like that 30 plus person per day mark, and brought it back in house, and then hired our own chef. And then they were responsible for preparing our breakfast, our lunch, doing our afternoon cooking demonstrations or our snacks, and handling everything related to the kitchen. And then that brought our food costs down, and we were probably able to save about 2,500 to $3,500 per day. So when you're first starting out, I don't think there's anything wrong with going the catering route. I think that if you were going to design your space, I think design your space in a way that you can cook in it long term. So make sure that like you go whatever the Department of Health requires you to have, so you can have kind of a full service lunch kitchen. You don't need like you don't need like necessarily, depending on what you're making for lunch or doing for breakfast, you may not need hoods and ranges and massive commercial production equipment. It just depends on how big your space is and how many people you plan on serving and what types of lunches you plan to offer. But the moral of the story is, I would design the kitchen and get it licensed as if you could create all your meals there. But then when you're first starting out and you have a smaller census, you might want to do a catering contract, or work with a local deli or someone in your area until you get to a certain point where you can make that switch, and you can do it in house.
Okay. Yeah, that sounds like a plan. My second quick question is, where do you get the money from? You know what I mean? Like, is that a separate money that you can bill for to get that money, or is that just gonna come out of whatever income that you have coming in?
Yeah, so we cover the cost.
Okay.
Like on the private pay side, you know, we whatever we're billing to those families for that day, you know, we're covering the cost of breakfast, lunch, afternoon snacks. We're covering the cost of all the activities and the crafts. You know, all those things are kind of included. You know, the all the assistance with personal care needs, toileting, transferring, help with all those things, like all that's being covered. The things that we would charge extra for, or might be additional, would be transportation to and from the center, assistance with showers, hair and nails. If you decide to bring in a hair and nails studio, if you partner with a third party, PTOT company, you know, it might be another way where like you're not billing them. It doesn't cost you any money. You know, but the family members might have to pay a copay depending on their insurance if they utilize those services. But for the most part, the majority of the things that you're doing in your day there, you know, are going to be like, you know, your costs that you need to make sure you've like priced, you know, your price point correctly if you're going private pay. Now, if you're Medicaid, it is what it is. Like the contract or the reimbursement rate is set in stone, and you're at the mercy of the state. You know, and at that point in time, you might have to look like if you were more of a Medicaid focused center. Some Medicaid programs might have a a thing where if you're over a certain percentage of people that you're serving are on Medicaid, you know, there might be different Medicaid programs that allow you to apply and get a certain dollar amount per person who attends that's on Medicaid that could help you offset your food costs. So I think
Thank you.
absolutely, Lillian, thanks for joining. I think I'm gonna do one more person, the first person to kind of reach out. You know, wants to jump on unmute, share your question live. Anyone else want to dive into it?
Yeah, I am here. Sorry about the whole set of things that were coming into the message part. It's just that my computer was acting up. Um, as I asked the questions like, what qualifications will my staff need? How many hours a day? I mean, yeah, how many hours a day do you have these staff on shift? And I know our currencies are different. We deal with Eastern Caribbean dollars, and you deal with the US money. But can you just give me a guide of like how would you pay your staff? You don't have to be exact, just a guide, so I could kind of have
Yeah,
an idea in terms of when I'm converting.
for sure. You know, Yolanda, you know, it's cool. We got I think Lonnie on here earlier was from Guam. We got you here from Nevis, right?
Yes,
I'm
yes,
I'm about to start traveling and visiting you guys. We got Nevis, we got Guam. I'm like, man, these are some cool locations to have an adult day center, you know? Talk about
yes,
an adult day with a view, you know? Um,
yes,
So, you know, it's interesting. So when I think about our centers, we every center is a little bit different. I've seen adult day centers that run schedules where they're open 9 a.m. to 4 p.m. or 9 a.m. to 5 p.m. or 8 a.m. to 4 p.m. We've always our hours our hours have always been Monday through Friday, 8 a.m. to 5 p.m. And then
yes,
we do open on Saturdays from 9 a.m. to 4 p.m. So it's a smaller day. And then when I think about our staffing, you know, so depending on the census that we have, you know, and depending on our locations, you know, sometimes we kind of will do a staggered staffing. So we might have like our openers might come in at 7:30. You know, we might have like one person that comes in at 7:30, one person that comes in at 8. So you have that one person to get the building set up, to get the coffee going, to get the morning routine happening. That person that comes in 7:30, you know, their shift may only go till 3 in the afternoon. The person that comes in, you know, maybe at 10 o'clock, you know, they're probably staying until 5 or 5:30, you know, depending on our census that day. And so we do have sometimes like a staggered, you know, start time and then, you know, staggered kind of in time for different, you know, people's day. And a lot of it just depends on, you know, when you think about that 1 to 5 or 1 to 6 staff to member ratio,
yes,
you know, we're kind of trying to assess that and plan for that a little bit. And then I think I mentioned earlier in the call, like, you know, we typically might have one or two people that are like our full-timers. Typically our activity director is going to be a full-time person. Like, we need that person here every single day. They're the one that's like, kind of creating the energy and the vibe and really, creating the experiences that our members are having here. And then our care team is really the one that we have the most flexibility with start and end times and who's part-time or full-time, to build some flexibility around. But there's going to be certain key roles that like are full-time or they're set in stone. Like for instance, our chef, our front desk, our administrator, our nurse, our marketing director, our activities director. Those are all kind of set in stone. They all have their own schedules and are all, full-time positions that, are required. And then it's really our care team that is the one that, is a kind of a mix between part-time and full-time people, And when I think about, people first starting out and it's a smaller space, all those people I mentioned, chef, front desk, admin, marketing, nurse, you might be all them, and trying to figure out
Right.
how to, do that. Right. So a
Right.
lot of times when you're first starting out, you might be the marketing person, and you might be the person that's assisting with activities or the person that's running the front desk, so I think you'd have to like, kind of figure out, hey, what are my strengths? Am I good at marketing? Am I good at operations? Am I good at, the meals side of it? Kind of figure out what my strengths are. Do I have a partner that's coming in with me, a friend or something like that? What are their strengths? And kind of figure out how many hats can we realistically wear, and then what are
Right.
our holes that we need to fill for,
Right. Right.
So like, when I think about, pay wise, in the area that we're in Florida, when I think about our caregiving positions, which is a, core component, it's usually like we always have like more caregivers than any other one role. So that care team, in this kind of Southwest Florida area, their kind of hourly wages are going to range anywhere between say 17 to maybe closer to about $20 an hour in Florida, in this part of the area. But there's areas all throughout Florida that could be, 13 to 16 or 14 to 17. I know in our area we're about 17 to 20.
Okay. Okay.
All right.
Yes. Thank you so much.
Absolutely. Well, hey, I'm so glad that all you guys could join us tonight. Man, what a great great questions. I think, just glad that you guys all could be here and love, getting together with everyone, love meeting new people who are aspiring to open their own adult day center. It's fantastic. If you guys haven't already, just know that like, the YouTube channel is there. There's over 300 videos on Adult Day. There are playlists on the YouTube channel. If you click on the playlist, you can kind of break it down by startup stage, financial, marketing. So if there's certain areas of interest that you have questions on, go to the playlist and then you can kind of like, decipher through and find the video that maybe is pertinent to whatever question you might have. We do this call on the I believe it's the second Wednesday of every month at 6:30 p.m. Eastern time. If you guys have any questions and want to, work with me one-on-one, you can go to adcpro.com. And I'll do coaching calls. So we have one-on-one coaching calls. You can go on there, book a 1-pack, 2-pack, or a 3-pack, whatever is convenient for you. If you haven't already, definitely encourage everyone that's interested in the adult day space, grab a copy of my book. It's The Great Care Crisis. And you can find the link to that at adcpro.com as well. It's a great book. It's all about, it's intended to meet the needs or to answer questions about the future of adult day and this looming long-term care, senior care crisis that's on the horizon, and how adult day is going to be the solution. This adult day, I truly believe, is the future of senior care, and kind of this Great Care Crisis book kind of helps build the case and really use it as a tool when you think about when you're talking to people in the long-term care industry, how to educate them on the benefits of adult day and why it's essential to the senior care continuum. So that being said, guys, that's all I got for today. I thank you all again for being here. We'll see you guys on the next
So
one.
just before you leave, can you please give us the contact number of the person in New York?
Yeah, New Jersey. I threw it in the chat. It's Joan Marie. If you go back up, I think it was at 7:05 p.m. It's futurefocusweb.net. And you can go to the website.
Okay, I see it.
You can go
Okay.
to the website there, and
Joan Mary.
all her contact information is on that website. You see it there, Nancy?
Yeah, I just saw it. Yeah.
Okay.
Joan Mary. Okay.
Yep. Futurefocusweb.net. Joan Marie is her name. She's in New Jersey, but she'll know people in New York for sure. So.
Oh, okay.
All right, guys.
Thank you, Kris.
Absolutely. We'll see you on the next one, and you'll have a wonderful rest of August, and we'll see you in September.
All right, thanks.
All right. Bye, guys.
Bye.